Hello, I'm Bonnie. I'm a manager of the Commercial Determinants of Health team at VicHealth.
And we're at the Health Promotion Symposium here, Bonnie, and you're leading a workshop now on commercial determinants. Can you talk about the main points you want to get across to people?
Sure. So we all know that harmful products are out there in the world: alcohol, tobacco, gambling. But what I think people perhaps don't know about as much are the systems and the practices and the pathways that sit behind those products. So this is about really helping health practitioners to really understand what's driving a lot of these harmful products that are causing so much ill health and harm, and really understanding what they can do about it at the local level.
And what were some of those examples that you could give across tax, etc.?
Yeah, so look, at the global level, there are things like corporations shirking tax. We know that when companies avoid tax, that's money that could otherwise be supporting healthcare systems, education systems. We know that intellectual property protections can also have dramatic impacts, and we saw this in the pandemic. Pharmaceutical companies were restricting the sale and access to life-saving drugs. So these are some of those global practices that really influence our day-to-day health.
So if we take the global then now down here to a local workshop level, what are you saying? How can people bring about change?
There are so many things that you can do. I think one of them is to speak up really loud and clear. This looks like being really clear in your advocacy messages, really getting together with people who really care about the same issue and really want to take action. It's being really clear about what you want from government and what you want from these commercial actors as well, and how they can better protect our health. So that's a big one. I think community action and mobilising community action is another one. We cannot fight these big corporations on our own. We're small, they're really big, but we can do so much when we work together. So that's building coalitions, finding people that can really amplify your messages. Another one I think that's really important is actually using evidence-based research. So we can fight a lot of these harmful practices through sound public health research. And so part of it might look like advocating to government to actually fund good industry-free research. So we know that's often used by commercial actors very cleverly, so we need to get around that. There's some of the really kind of key things that come to mind for me that people can take.
And out of the blue, is there an example you could give of a really good local change that addressed those kind of global issues?
So one that comes to mind is actually, it's a case that happened in Darwin in Dan Murphy's wanting to set up a store opposite a remote community. And this Aboriginal community is a dry community. So this was a huge fight that a lot of community members, health organisations had on their hands, because the application at one point was sailing through and it looked like it was all going ahead. And through getting community to be spokespeople for this issue and how it would affect them, showing evidence of the harm that it would cause, bringing together so many different voices on this one issue, galvanised this amazing grassroots response. And through very carefully engaging politicians and lobbying the Woolworths at the time, who were part of the group behind it at that point. All of those little levers really helped change the whole course of history, and now pleased to say that they were successful and there isn't that Dan Murphy's mega store anymore. So I think to me that was such a beautiful example of what change can happen when you come together.
Fantastic, Bonnie. Thank you very much.
Thank you.